Vaccines reduce infectious disease burden more effectively than any other public health strategy, with the possible exception of the provision of clean water. But I have to ask each and every one of you, do you have a vaccine schedule? Do you know when you're due for your vaccine? Do you know whether you're eligible for the pneumonia vaccine? Have you had influenza vaccine? And some of you will say, do you know, I'm actually really healthy. I don't need the vaccine. And that's why we're having this very session.
We have to define the barriers, what prevents us to get the vaccine and to build up a strong and successful vaccination sheet. So I'm very sad to say that, but the healthcare staff is sometimes the sole barrier by him or herself. So when you look at the barriers, when you look at the beliefs and attitudes and perceptions of the healthcare workers, they are usually parallel to those of the general public. So healthcare workers, sometimes they do not believe in the effectiveness of the vaccines. Sometimes they do think that the vaccine's side effects are so much that may prevent themselves from getting that vaccine. Or they may just think that influenza is not an important disease, they do not contract influenza, or they can just protect themselves by taking other measures. So these are the barriers that can also be interpolated to the general public. So if the healthcare staff has such negative perceptions, beliefs, and attitudes, how about the general public? So this was a study that we have done in our general patient clinic, and we asked the patients about their thoughts and beliefs on adult vaccination. And what you see here is that, for example, when we asked the patients, which vaccines do you think are needed in adult life? 1 in 3 of the patients thought that influenza may be needed, but this was the highest number. And when you look at the other vaccines like pneumococcus, like shingles, people are not aware of these vaccines, so they have no idea about them. And when you ask the patients who never get vaccinated about their negative attitudes, so nearly half of them said that vaccines are not necessary and vaccines are for children. So we have the barrier there. We have to just convey the correct messages to the public in a correct way.
If we are able to increase vaccination rate, we will possibly have less infections. Having less infection means having less need to use antibiotics. That is, strategies to reduce in the future the problem of antimicrobial resistance. And just to close and reinforce what my colleague said before, we have to work hardly to improve our coverage for these two infections. For influenza, about 30 to 80% is covered, depending on age, chronic disease, countries, and so on. If you look at pneumococcal disease, the coverage is much, much lower. And only 42% of the worldwide coverage was described last year, so we still have a lot of countries where pneumococcal vaccine does not exist at all. So we still have a lot of work to do.
The problem is that people are in love with antibiotics, and because of that, remember what I told you at the beginning, that antibiotics and bacteria equals antibiotic resistance. And as you saw, the projection is that more people are going to die by 2050 annually. Those numbers that Eva was showing were annually, a projection of 10 million. That's more than cancer and traffic deaths combined by 2050. And now there's a high likelihood that you're going to get antibiotics in the next few years. If you're in a long-term care facility, you have a 50% chance of being given an antibiotic each year. That is absolutely absurd. But what that means is increasing antibiotic resistance. And as I said, our best defense to prevent the need and use of those antibiotics, and therefore antibiotic resistance, are vaccines. The vaccines that we have already, and the vaccines that we need to get developed, and the vaccines that adults and older adults need to get so that they can live healthily without antibiotics, without infections?
I mean, my question is, how do we actually target specific antigens to the elderly when there's so much confusion around processes? The pneumococcal vaccine that was given an example of, Germany wrote a report that said don't use conjugated vaccine. The Brits said don't use conjugated vaccine. America said use it for 3 years and then we'll review. Canada, as Andrew pointed out, is very permissive but doesn't recommend it. Hard to convince doctors that they should change their policy about what to do when we can't agree on whether the vaccine's worth using at all.
Yeah, I think that you've touched on a couple of points, and one of them is how do you sell messages? And I would ask, how do health professionals sell the message? But also the complications of vaccine schedules. So perhaps you could make a comment on that.
Yeah, I had a slide I decided to skip because of time constraints that shows in Europe, the table of recommendations across different countries, and it's amazing. It's amazing. So it's clear we need to homogenize the way we approach the problem worldwide. It's really important. So you could have recommendations starting at the age of 50 or 60 or 65, even for children, different time scales are found. So it's really a problem. So this means a global approach to the problem. And the second point you touched is regarding healthcare professionals. I think most of my work in the sense of favoring vaccination has been in educating healthcare professionals. Most of the people in the audience in my last, in my experience, did have no idea about how vaccines work, how they are produced, about their safety. So this is a big issue. We need to educate healthcare professionals first, in my opinion, because it depends on them. The rate of population, at-risk population, are getting vaccinated on a daily basis. So it's really important to insist on education worldwide.
Please join with me in thanking our speakers.